Hello and welcome to Coffee with Dr. Carla. I'm Dr. Carla. This is Angie, and we're really glad that you're here with us today. Our goal is to talk about mental health related issues and hopefully start to end the stigma around them. And so today we are going to talk about something that probably, I don't want to say no one knows about because clearly people have been diagnosed with this, but very few people know about. But it is far more prevalent than what people realize. So, trichotillomania. And so I'm sure many of you out there are going, what? What is that? And that's why we have Angie with us. She's gonna, today we're just going to talk about like what it is and whatnot, so that we can have a better understanding. And I think it'll be interesting to see as we progress, and when this gets aired, how many people are going, "Oh my God, I do that," and they don't realize that it actually is a thing, right?
True,
So,
very true.
why don't you tell us, what this, you know, um, you know, thing is, um, and how can so many people have it but nobody knows about it, you know?
Right. Okay. So first of all, trichology is the study of hair and its follicles and in general all about hair. And so trichotillomania stemmed from that. I believe it's a Greek word, trick, Trich, and then a whole bunch of letters after that.
Of
It's a
course.
big long word. And there's also dermatillomania, which is, trichotillomania is pulling out your hair, playing with your hair. It sometimes starts with just twirling and but picking. So that is something that I've been doing since I was probably in junior high, eighth grade, freshman year. But it's considered trichotillomania and dermatillomania is considered a BFRB, which is a body focused repetitive behavior.
Okay.
So the pulling out of the hair.
So
Um,
is it just this hair or is it any hair?
it could
Could it
be
be eyebrows, eyelashes?
absolutely, it
I mean,
can
I guess
be.
if you've got hair on your
It
arms
could
or
be
whatever.
anywhere.
Yeah.
It could be
Okay.
pubic hair. But for me personally, it's my head.
Okay.
Specific areas, and I'm learning more and more about my triggers to why, to when I'm doing it, and having a really more keener awareness of when I'm doing it. So the body focused repetitive behaviors, they do mention on their website that it's the most common thing that people deal with, but nobody knows about it, like you had said earlier. And it could be cheek biting, it could be lip biting, it could
Oh,
be
okay.
just scratching your thumb till it bleeds, kind of just a repetition.
I
So if
guess
you think
chewing your
repetition,
fingernails would fall in there, right?
exactly, fingernail biting, fingernail picking, because part of it historically goes back into grooming too. Like you have a
Okay.
scab, and so with the dermatillomania, people will be picking scabs off until there's dangerous infection at times. It could get really,
Sure.
really, really fast. And with the trichotillomania, with the hair pulling, you could be looking just fine and dandy one day, but then the next day you have had an episode. So you have this big bald spot or patch somewhere on your head.
Yeah, I mean, I just know for myself, like, so I've got a couple scabs here, and I'll sit here and do stuff like this.
Yeah.
Not necessarily pick it, but, I could see where you don't even realize that you're doing something that is
Yeah,
potentially harmful. I'm just, checking out my scabs, hoping that they heal up faster or
sure.
whatever. But
Yeah.
as I look at it, I could tell that one of the scabs came off because I was messing around with it too much. But,
Yeah.
we're not talking about that. We're talking about where it becomes
Becomes
so
repetitive.
repetitive, right? So
Right.
repetitive that it actually starts to create problems.
Exactly. And unlike the DSM-5, I don't know if you want to
hmm
describe that.
Well, it's the diagnostic manual that we use when we see a client and they talk to us about what's going on. It's what we use in order to make a diagnosis, right?
Hmm.
We make diagnoses so that we can make effective treatment plans and you know help treat whatever's going on with our clients. Insurance companies also want to have a code so that they know how to bill or to kind of make sure that we're not just seeing clients because we have nothing else better to do, right?
Sure.
Because
Yeah.
clients always want to come in and get mental health help because there's nothing wrong, but whatever, that's another whole show. But,
Yeah.
the reality of it is that, we all use this, whether we're talking about psychiatry, social work, counseling,
Hmm.
um, uh, psychology, and even though the majority of those are dealing with psychological issues, because it's put out by the American Psychological Association, um, they are they're those same issues and their diagnoses and their codes align with the medical world as well. So there are some that overlap. So I would venture to guess that something like this would be something that either a medical physician could diagnose, right? And then the code would be the same as if it's a medical versus mental
Sure.
health,
Yeah.
right? Um,
It gives a base for you to
right.
provide a lot of things. A
Right.
lot of
And so then
things.
we say, here's the criteria that needs to be met. And then we can say, all right, based on this, we can talk about the symptoms that come along. And then that's
Right.
how we create
Hmm.
our treatment plan, right? Um, it's a
S-
place to jump off for sure.
Yeah. So according to the DSM-5, they say that it is in the category of OCD.
Yeah,
It's still being researched a lot.
right.
And there's a lot of studies, clinical studies, and all different types of. There's a couple of medications they're looking at that might help with diminishing some of it. But
And the reason why they've lumped it in with OCD, so just in case you're not aware, OCD stands for obsessive and compulsive disorder.
sure,
So, if you think about it, the obsessing over, the fretting over, constantly, checking it out. And
yeah,
then the compulsive is like, despite my attempts to stop, I can't,
exactly,
right? And so
yeah,
that's where that comes in. So it's not,
sure,
your traditional uh, kind of stigma that you think about around OCD, like I have to check my locks 25 times. Yeah, that's not, you
yeah,
know,
that's different. Yeah,
that's totally
doesn't
different.
involve the body. Yeah,
Right. So that's why it gets in that
yeah,
category, right? So it makes sense that it belongs there, right?
right.
And
It
then
does.
when we talk about treating it, we can understand that, despite the desire to stop, people often struggle to stop. It's not as
Absolutely,
simple as me saying, now, Angie, don't do that anymore.
exactly.
Because if it was, boy, I'd be rich and the world
Sure,
wouldn't have any problems, right?
right.
So,
Yeah, yeah.
um, so okay, so you said you've been dealing with this for a long time.
Mm.
Were you diagnosed? How did you realize that this is what you were dealing with?
Yeah, I wasn't diagnosed. I've always known. I don't remember a lot. I think I like pack those things in those spaces in the brain so you don't get a chance to remember them sometimes. I think
Sure.
that's our survival mechanism, I believe, in some instances. But I've not been diagnosed. But my sister was a psych major, and she was the one first who really like gave it a name. And the big trichotillomania, we can call it TTM for short,
Okay.
actually, the acronym for it. And so she had an awareness of it, and they would put brochures in my hands. And in fact, I have that file folder, and I have never taken advantage of reading anything in it, and I still have to do that. So that's how much the condition can really, there's shame behind it, there's anxiety behind it, there's different triggers that accompany both or all of them probably. Like you'll see somebody just chewing on the inside of their cheek
Sure.
when they're like uncomfortable or when they're a little stressed out or anxious.
Yeah,
So
sometimes getting a name for what's going on with you can be helpful because you're like, hey, look, I'm not alone. But other times,
mm,
then if I get a name for what I do, then oh, it's real.
yeah,
Uh-oh,
yeah,
I should do something.
exactly. And maybe that's why I have never gone to get it diagnosed, because I know what it is. I'm dealing with it in many different ways over all the years of my life, and more so these last 4 years. I've really, really dove into it more full blown, and I don't think my hair's ever looked better than it is right now. I have a tendency to pull more so on the top.
Okay.
Yeah,
So as we kind of finish up today, if there's one thing that you would want our audience to know, what would that one thing be?
is know that you're not alone. There's people out there. It's like 1 in 4, and it's very, very, very widespread, and more so now with COVID coming out of the pandemic. So just don't be afraid to really just look into it a little bit more, talk to somebody. Talking has been so critically important for me.
Okay,
And that would probably be the best thing I could suggest at this
awesome.
moment.
Thank you
Yeah.
so much. So remember, you can change your thoughts, discover your potential, and transform your life by focusing on your overall well being. So until next time, continue working on being the best you possible. Bye now.